Hello everyone, this is Dr. Sabha, the admin of Preserve and Care, and I am back after so many days with a very interesting topic for you all. And I would like to share a few words on this amazing topic. And this topic is psychosomatic weakness, or you can say psychosomatic disorders. So, what is exactly psychosomatic weakness or psychosomatic disorders? So, बहुत सारे लोग जो डिप्रेशन से सफ़र कर रहे हैं, जो मेंटल इलनेस से सफ़र कर रहे हैं, बहुत ज़्यादा ये चीज़ देखने को मिली है दैट उनको फिजिकली सिम्टम्स आने लगते हैं आफ्टर सर्टेन टाइम ऑफ सफरिंग. They starts to experience physical symptoms, for example, chest pain, muscle weaknesses, feeling of paralysis of certain areas or numbness of the parts, body parts, and वो बहुत ज़्यादा persistently रहता है. The reason why this happens is because of the phenomena called psychosomatic disorder weakness. So we all know that when we are like struggling mentally, कुछ टाइम के बाद हमें सिम्टम्स फिजिकली भी शो होने लगते हैं. एंड व्हेन वी गो फॉर इन्वेस्टिगेशंस और एनी फिजिकल एग्जामिनेशंस or anything, we come with all the normal reports. There is nothing wrong inside your body. All the scans, all the blood tests, everything is completely normal, but still the patient is feeling physical symptoms. So why is that? What is psychosomatic weakness or disorder I'm going to talk about? So as I have already told you, psychosomatic illness originates from or you can say that it is aggravated from emotional stress, and it manifests the body as you can say physical pain and some other symptoms also. So depression can also contribute in psychosomatic illnesses, especially when the body's immune system has been weakened by severe stress or chronic stress, because when anything becomes chronic, it actually starts to build up a permanent side effect. We can say a permanent they leave traces for your body to get unfit. And the most common misconception that psychosomatic illness or the psychosomatic conditions are all imaginary. All when you'll consult somebody, they'll just say it's all in your head, there is nothing wrong with you. But in reality, these physical symptoms of psychosomatic conditions are real and require really good treatment. Worst thing about this issue is that it is a social stigma, and it is attached to psychosomatic illness may prevent someone from seeking treatment because of the stigma. Even when someone seeks treatment, stigma is also present in research and medical communities also, unfortunately, and at least in a part where the mechanism that drive the stress illness relationship are not fully understood. Unfortunately, this is very bad. So this is a huge misconception. And when a person is suffering from some issue, mental health issue, and these symptoms are ignored continuously by the physician as well as people around the person who is suffering, so these create a very bad chaos into the person's mind, and it may affect too much for the person to get that he or she gets damaged. So yeah, this needs to be understood that these psychosomatic illnesses actually true, and it plays a very bad role in making all the mental health condition poor. So now you know that what are the misconceptions of the psychosomatic illness and what exactly it is. You must know what are the physical signs, you can say the common signs, physical signs that include stress. You can say that butterflies in the stomach, we say, you already know, racing heart, sweaty palms, tense muscles. Bodily signs of stress may be different depending on your biology, male or female. For example, as we all know that women often report symptoms such as fatigue despite of getting enough sleep, or irritability, abdominal bloating, or the changes in the menstruation periods. So signs and symptoms of stress in male, basically, it on the other hand most importantly include chest pain and increased blood pressure and changes in obviously sex drive, because it affects that also. And symptoms of stress may also vary by age. As you all know, children these days are very prone to mental illnesses. Children with coming from a very broken families, broken separated parents, or any childhood traumas, experiences stress their body, because they haven't yet developed the language they need to communicate how they feel. So for example, a child who is having a hard time at home or school may have actual frequent stomach aches. They complain for not going to school. They just want to lay in bed and just not do anything, do not take bath, may be sent home or asked to stay home. So stress in teen years can be especially intense, particularly during periods of major social adjustments and hormonal shifts. So sometimes signs of stress in people of this age group especially may be missed or attributed as teen ages. Why? Because बोलते हैं कि like कि जो बढ़ने वाली उम्र है, adolescence है, इसमें people the adolescent people are prone to mood swings, but it is not. Actually, it is adolescent depression. It is a word, it is a statement that speaks for itself. So the elderly are also prone to depression, and you as already know that they are often contending with several compounding factors such as isolation, grief, and we can say that chronic or serious health illnesses, which makes their mental health more prone to get even more worse with their physical already existing comorbidities. So yeah, it has to be taken care of. And now coming for the causes of psychosomatic illness, there are actually different kind of stress, some of which can be positive. Eustress is what makes life more interesting, and it is a feeling that it makes you want to get up in the morning and keeps you motivated. So if you ever enjoyed the thrill of roller coaster ride or felt a sense of excitement and fulfillment when completing a project or a task, you experience good stress. And on the other hand, if you experienced a major loss, gone through a big life change, or endure other stressors, or the bad stress, how the bad stress feel like giddiness and uplifting feeling of good stress, all over the negative effect of the bad stress can be felt in your mind and your body, obviously. While the exact mechanism are not completely understood by the researchers also, that why the stress and depression can be expressed as physical pain and illness, it's a very complex explanation. Now compare your body to a pressure cooker. If it's allowed to vent its steam, it works efficiently, all right, but same way, if it can't be vent properly, the steam, obviously the pressure continues to build up and until the lid blows off. So now imagine the cooker is under pressure already and you apply more pressure to the lid. So what it would do? That's obvious, it would burst. So like the pressure cooker giving way at the weakest point of its structure, stress related illnesses is most likely to develop when your body is already weakened. So someone who is under stress or able to vent their emotions or tries to keep it all in will eventually reach out an emotional, very disappointing, emotional, devastating breaking point, and it may manifest as physical symptoms or trigger an episode of major depression. So in retrospect, you also may realize that there were some warning signs or clues that such a break was coming, that everybody missed that clues or the signs that it is like the meltdown point now. And especially in terms of the physical pain, the symptoms you experience, for example, if your neck has been your physical weakness, you find all the pain increases when you're stressed. Back pain, stomach troubles, or headaches are also very common ways of your stress may take up residence in your body. So stress also compromise your immunity. Some people find that they are stressed, they are more likely to catch a cold or flu. You also start to observe if you are going, unfortunately, with a mental issue or any mental trauma. Just observe that you may get more infections or take longer to get better when you are actually experiencing some mental weakness or mental issue, anything. These chemicals are an important part of body fight or fight response to stress, may be very useful. However, the body has high amounts or they are released continuously over an extended period of time. These chemicals may do more harm than good. So how would you diagnose the psychosomatic illnesses. So when you're describing your physical symptoms to your physician, they will generally look first for the physical explanation for your pain. If there is no obvious physical cause that you can easily test for, coming up with a diagnosis and a plan of treatment may be very tricky. When this happens, people might feel like their doctor is not taking symptoms seriously, or they're just ignoring you, or you're suffering. Any doctor would ask you, how are you doing emotionally? And you sometimes may feel like, what is the link between questions the physician is asking, especially when you are coming to a homeopathic physician, or you are consulting a homeopathic physician. The first thing he would ask or she would ask you would be that, how are you doing mentally? Is anything up with you? Is anything wrong with you, or any physical trauma in the past? So it actually determines how the physical and the mental symptoms are interlinked with each other, and how psychosomatic illnesses have the root to all your physical symptoms. And the hope is that if a source of stress can be identified, it can be treated. So you need to be very clear with your physician about what you're feeling, because it is obviously very confidential for you to share, and the doctor to keep it with him or her. Being a doctor, I would just say that whatever you feel in your body is very real, and they are just caused by different mechanisms that say, if you broke a bone, like if you broke a bone. So what are the treatment for psychosomatic illnesses? The most effectively mode of treatment is to manage stress by counseling, and to go to a psychologist and get some good counseling sessions, and you need to be very vocal about what are you feeling and how are you feeling, and you should accept it first of all, because denial won't help you to raise up your prognosis. It would only make your physical and the mental symptoms even more worse if you'll start to hide it, and it would actually fill, and then you're actually like the pressure cooker example I gave you. It would happen like that. So I'm sure nobody wants that. So yeah, managing stress is the most important thing to do. Next is to avoid your triggers. For example, if you're having a pain in your neck, and leaning to cope with stress triggers can certainly prevent from it to happen, but the pain is not only in your mind. No, it is not. You're actually suffering with it, and you should also accept it. And the physician you are consulting, you should be very vocal about your issues, that why are you having the neck pain, and after what you are experiencing, it is very important. So while it might start in your brain, stress can be very cassette of chemicals in your body that produces inflammation in the muscle of your neck, which is in turn cause of pain. You may need anti-inflammatory medications, but when you are coming to a homeopathic physician, you would be given medicines according to what emotions you're having. With your mind symptoms, the medicines are best and well selected homeopathically, which have no side effects, and we also give you the regimen to follow, such as massages and physical therapies to manage and maintain the equilibrium between the pain and the treatment. So another helpful analogy is to think of psychosomatic illness as a flooded river that happens after a dam breaks. The most important step for preventing more flooding is to fix the dam, right? So however, it is also necessary to handle the flooding that's already happened while the damage is being actually repaired. So once you know how to recognize when you are stressed and have identified source of stress in your life, the next step is to learn coping mechanism, and one of the first and the most important is to avoid holding in your feelings like a pressure cooker, as I already said. Stress that pent up in your body burst out, and so you need help for that, and you need to be very fine and vocal about it. Mental health is not a stigma. It is not anything you should be ashamed of, but it should be something you should get treated for, and you may need people in your life. Don't be alone. Don't think that anything is wrong with you. Mental illness is very common these days, and you should know how to do it and when to do it. Thank you for watching this video. I hope you like it. Please share with everyone. Thank you.